Good afternoon, everybody. Welcome to our media update, our time once a week to check in with the media to share some specifics about what's happening with COVID-19 in our community and to answer the media questions that come to us in advance. And also, as you like, you can put them in the chat box and also put them. We'll be able to have time at the end to unmute to share those questions as well. So again, thank you and welcome to our time together. We appreciate that you are here. It's November 5th, Thursday, November 5th. It's been a challenging couple of weeks, I will tell you, for our response team, for our community. It's been tough. And I would like to start by saying that the partnership and the community effort that is going into responding at this point is critically important to all of us. We need you, and we need you to lean in and help support us having a healthier community. Our public health system right now and our healthcare system right now and our businesses and our educational systems are really struggling due to increased cases of COVID-19. Our families and people individually are suffering. So there are some basic principles and practices that we've been talking about all along, and we continue to reinforce are needed to slow the spread of COVID-19. We'll be talking about that more in a minute. I'll walk through the state status update like we always do, and we'll talk through the Eau Claire information as well as give you a couple of updates that have been happening in the region as well as the state. And then again, we'll do some questions at the end. The total negative test numbers for the state of Wisconsin now are at 1,881,813. An additional 78,348 PCR tests have been done for COVID-19. The total positive counts, the number of people in Wisconsin that have gotten COVID-19 are now at 249,924. We're very close to being over 250 cases of COVID-19. It's an increase of 34,928 since last week, Thursday. Yesterday, on the 4th, we saw the single highest case day. So 5,935 people yesterday were identified as having COVID-19 in Wisconsin. We now have 12,310 individuals that have been hospitalized with COVID-19 at some point. That is 4.9% of our cases. An increase of more than 1,300 people in the last week have been hospitalized in Wisconsin, have gotten this virus that has been serious enough that has meant that they've had to be in the hospital. Hospitalizations are increasing across the state, including in this region. We are now at 2,194 Wisconsinites who have died of COVID-19, an increase of 246 people that have died. The state 7-day average positivity rate, so that percent positive by person tested, one person tested multiple times is counted as one negative and one positive if they become positive, is at 32%, the highest ever. So again, as of yesterday, we have that positivity rate in Wisconsin. The positivity rate by test in Wisconsin, again, if an individual gets counted multiple times, all those negative tests are counted in the denominator, is at 16.4%. Again, the highest we've ever had in Wisconsin yesterday. Those trajectories, those percentages, and our counts of cases are going up. The slope is like this on all of the graphs. Not a good thing for our state. In Eau Claire, we similarly are not doing well. Again, this virus is very contagious, and we are in a space now where it is spreading rapidly. We now have had 31,717 negative tests, PCR tests for COVID-19. We have 4,556 Eau Claire County residents that have been tested positive for COVID-19. We're averaging about 128 cases a day this past week. The positivity rate for Eau Claire by test is 18.6%, up over 8% in the last week. As you may remember, I just told you that our state positivity rate by test was 16.4%, the highest ever for the state. We are higher than that in Eau Claire. Today, we had really for the first time a record number of cases beyond what I think any of us could have imagined, at 240 positive cases for COVID-19 reported. Those came in yesterday and were reported today on the website. It's the highest ever, and it's highest by 62 additional cases. So not by a couple of cases, but by a lot of cases. Of our positive cases for COVID-19, the individuals in Eau Claire that have had it, 3,508 of those have recovered. The remainder we're actively working with to remain isolated and their close contacts quarantined. Of the people that have tested positive, 151 individuals have ever been hospitalized, an increase of 23 individuals just since last week, Thursday. We now have 28 Eau Claire County residents, our friends, family, neighbors, coworkers that have died of COVID-19, an increase of 12 individuals since last week, Thursday. Most of these people have been above the age of 65, and many of them have been with underlying conditions. But again, the cause of death was COVID-19. I think we should all pause and remember that in our friend and family groups, in our coworker groups, and in our churches, synagogues, and places of play and worship and learning, we have many people that are over the age of 65. We have many people that may have some underlying conditions, but certainly we didn't expect them to be hospitalized and or to die from this disease. It is serious, and we have to pay attention to that. Public health investigations, again, we report once a week to all of you. Again, the state updates those on their state website once a week. We are now at 54 active investigations. Again, the reminder that that's one individual at a long-term care facility or two or more individuals in other settings that are connected as positive cases. This is higher than we've previously had. We continue to see increasing outbreaks, but 12 in other settings, 16 in long-term care settings, 12 workplaces, 6 educational facilities, 4 healthcare facilities, and 4 group housing facilities all have outbreaks listed on that state website. We remain in the very high COVID-19 activity level for the state. I'm sure not a surprise to anybody listening. In fact, our case numbers at this point are really off the chart for both the state ratings for COVID cases, but also any of the national standards for the number of cases per day or week. We are exceeding that by exceptionally high volume. As of Monday, November 2nd, 24% of all cases since the beginning of January were affiliated with UW-Eau Claire. Again, a steady percent over time recently. We do know that we are seeing cases across the county, rural, urban, every jurisdiction. We're seeing cases in every age group. Yes, our 18 to 24-year-old age group remains as a high proportion of cases, but we are seeing new cases across all age groups. And again, a reminder that there really isn't a place in our county that isn't seeing community spread of COVID-19. Just a little context of additional numbers for you, if you are a numbers person. Our 7-day average this past week, again, was well over 100 cases per day. Our goal is 10. 1 month ago, we were averaging less than half of that. We've had more than 110% increase in our case numbers. Since September 7th, we've been at or above the range of daily cases, 25 or more a day, where it's recommended by many national experts to be all staying home rather than doing our normal activities. We all know that all of us across Eau Claire want to get back to normal as much as possible. We all know that we are trying to do as many of our regular and critically important activities as we can, but do know that public health experts across the world would say at our case numbers that our numbers are concerning and we should be staying home pretty much. We're not seeing that as the next step or the next strategy, but we are pleading with people in Eau Claire to really take seriously staying 6 feet apart, staying with a very small group of people that are your close contacts and not congregating in larger groups, really making sure that you're staying home if you have any level of symptoms, and getting tested if you are someone that is experiencing symptoms or you're someone that is a close contact. We need to know what disease is so we can slow it down. If someone is not aware that they have COVID-19 and they are also not practicing the basic strategies that we have in place, it's a risk in our community. So wear your mask, stay 6 feet apart, and stay home if you're sick. As of Monday, November 2nd, we had 222 individuals connected to our Eau Claire County Jail tested for COVID-19. 15 have been positive in that testing and 11 have recovered. A couple of announcements for you and reminders. Flu vaccination is critically important. I can't tell you a more important year to consider your flu vaccination being something that you get on your list. My daughter texted me this morning. She's in college and she said, "Mom, I got my flu vaccine today." So I encourage all of you, get your flu vaccine, tell your friends and loved ones to get their flu vaccine. It's important. If you have a doctor or pharmacy, please find the easy way to get that vaccine. That's the quickest and most effective way to get that done. We also, this weekend, will be holding a flu vaccination drive-through clinic on November 7th, on Saturday, for children and youth ages 6 months to 18 years. That'll be in Eau Claire at the parking lot outside the YMCA Sports Center, or the soccer parking lot if you are a family that knows about soccer. It's at 3456 Craig Road in Eau Claire from 10 a.m. until 3 p.m. Again, that's a free flu shot targeted for children. It'll be a drive-through clinic. We, again, like I shared a couple of weeks ago, are using this as a way to really practice and work through the glitches of doing a drive-through immunization clinic. We're anticipating using this kind of strategy as we walk into the spring and have available vaccination for people for COVID-19. We also want to let everybody know that as you look at our website, we have a revised data page. So you'll see this morning on our website, we added some new data and it's formatted a bit differently. So we have 7-day average caseload. We have percent positive over 7 days, as well as some additional hospitalization data. Our local metrics, are those measures that we are doing, red, green, and yellow, continue to be on that site as well. And we hope to add additional graphics in the future, trying to make it more accessible for people to understand what's happening with COVID-19 as we go through the upcoming weeks and months. Local and state health departments not only want data out there to make sure everybody's informed about what is happening with COVID-19, but also because that's how we make decisions. We use data to drive decision making. We look at local context and best practices, but we also look at our data. The governor, for example, looked at the data this week and really came out strongly saying we need to work together to stay home as much as possible. And that's really a data-driven decision coming from the governor to communicate in that way. Again, we're asking people to really lean in to work together on this. We also want you to know that yesterday, UW Eau Claire, and I joined them during a media briefing related to antigen testing happening in the community. The University of Wisconsin-Eau Claire did receive from the federal government in a partnership with UW System and the U.S. Department of Health and Human Services received a shipment of an antigen test for COVID-19. It's a type of test to screen for COVID-19 with a follow-up PCR, or our gold standard test, for those that are positive in our population. That asymptomatic testing, testing for people that don't currently have symptoms, but to see if they are having COVID-19 and not realizing it, has started today at UW-Eau Claire on campus for their students, faculty, and staff only. It will be expanding to the community with a community site, hopefully identified early next week, and starting rapidly after that to test individuals that are interested in knowing about their status related to COVID-19 on that day. Antigen testing is a resource for us. We're seeing it as an opportunity. It does have disadvantages in that because of it being a screening test, it could have some results that need to be verified again with the PCR, and the system is being set up to do that. Again, we hope to have that testing available in the next week, and it will be here, this resource from the federal government, likely for the next 4 weeks or so. Gives us a picture of what's happening in our community. Again, every week we update our metrics. So I talked about that a little earlier, but those measures that we're tracking over time to help us with making decisions and help the community understand where we are at. Hospitals continue to be considerable partners as we work on COVID-19 strategies. We are working, as always, really to make sure that their capacity remains strong for all of the things that we need them to be doing in our community to take care of people that need hospital care. They are doing that. People need to know that they need to go to the hospital if they have an emergency issue or an urgent health issue that needs to be attended to at a hospital setting. We are also working with them on all kinds of testing. So our healthcare centers, our National Guard sites, as well as our outbreak testing that we're doing with partners is all a critically important part of our response and something that we're measuring over time. Really, every day of the week in Eau Claire, you can get testing if you need it. Please go to our website, covid19eauclaire.org, to find those resources under the testing tab. Despite testing, despite the work that our system partners are doing, our data is showing that healthcare, our hospital systems are continuing to see a strain related to COVID-19. The number of people hospitalized each week is increasing in Eau Claire County as well as across the region and the state. The percent of inpatient hospital beds in use is being tracked now, and that measure is online over the last 14 days. That was at 77%, but is increasingly looking concerning. Our ICU beds are also being tracked, and that is at 89% in the region right now of our ICU beds are in use. We are also carefully watching the number of COVID positive individuals that are in our healthcare settings, and in the region, that number does continue to grow. We reported on that last week, and the number has only risen over the last 7 days. So again, important for us to be paying attention to keeping disease spread low. We also know that healthcare settings and many of our business settings are facing staffing shortages because of people isolating and being in quarantine. Disease in our community means that our workforce is also facing that. Our healthcare workers are ones that we need to also protect and make sure are staying safe. And I really want to emphasize that we need healthcare to be strong, and we need the community to help participate in that. Again, a number of other measures are concerning and in the red. Our outbreaks in the last 2 weeks new outbreaks are at 29. Our community spread is at 35%, which is in the red. Our case contact follow-up and our case follow-up and our contact follow-up continue to be challenging. As we shared earlier, really starting last week, we are no longer in contact with individuals that are close contacts of cases. We are not able to do that, and we are asking the individual that's a positive to communicate with their close contacts, their family members, their friends that they were in close contact with. Make sure that those people are quarantining. It is mandated that people that are in close contact with a case be quarantined for 14 days. The communication about this is on our website. We made it very easy to find right on the front page of the website. It says simply if you're a case or if you're a close contact, and you can link on that and know what to do. Our first priority is talking to cases. The health department team is, even with the 240 cases we had yesterday, really working hard to reach every single person and make sure that they at least have some simple information about what to do to stay home so they don't spread disease, and to make sure they understand how to tell their close contacts what to do. We are also working with partners to make sure that our partners, like our schools, UW-Eau Claire, CVTC, are working with us to make sure that those populations are notified when there's a potential close contact in those settings. And we really appreciate the work that all of them are doing to make sure that that information gets out. I will tell you that really, again, the work we have to do is work we need to do together. We need your help. This is a community problem, not a public health problem or a healthcare problem. This is a community issue now. It has been really since the start, but even more importantly, I think we all need to own that this is a community issue, and we need community solutions to really work together on making a difference. Again, personally, we need to ask all of you that if you test positive or are a close contact, that you go to the webpage, you look for the information there. Someone that is a close contact is needed to to quarantine for 14 days. Someone that is a positive case of COVID-19 needs to follow the direction from the contact that they get from the health department. And if you don't hear from the health department right away, we need you to go to the website and really isolate, stay home, and don't go to work, don't go to social events, don't meet together for any reason. We can do this together, and I think I know I can count on this community to make a difference. We've worked together on tough things before, and we can do this. So I'll go through some questions from the media first, and then if there's questions in the chat box, I'll ask Audrey about that, she's in a different room, and that's why I get to not wear a mask today as I talk to you. But she'll share those questions with me, and then if you have any additional questions, you can certainly unmute after that. So first of all, can the health department provide the approximate age range of the 7 Eau Claire County residents who died of COVID-19 this week, and if those people had underlying health conditions? Again, it's really tragic that we have to be talking about deaths related to a respiratory disease. Again, it's not a usual thing in this community or any community to have this volume of people die of something that, like pneumonia or influenza, we hope nobody dies from in a year. At this point, we can't give specific information about the 7 cases as requested by the question today, but we do know that most of our cases to date have been people with some level of underlying conditions, not all of them, and most of them have been over 65. We really, again, our thoughts go out to family members, to those people that have lost loved ones in this way, and we really hope that we don't all have to have that kind of wake-up call to be paying attention to this seriously. So another question, what does this significant uptick in COVID-19 deaths mean? Is this indicative of much more dangerous spread of the virus in the community? Again, we should care. These are people in our community that have died. The basic math, frankly, is that the more cases we have, the more hospitalizations we will have, and the more deaths we will have. While many, many people will get this disease, as you have seen already, and not die and not get hospitalized, there are a large number for a disease like this that will be hospitalized and will die. So the fewer cases we have, the fewer deaths and the fewer hospitalizations we'll have as well. It's also true that if we can spread out the people that get ill over time, and if we can particularly protect our vulnerable populations that are older adults and those people with significant compromising health conditions, we will also have fewer deaths. one of the things we've seen over the last number of weeks is that we are seeing more cases in vulnerable populations, places like congregate care settings and nursing homes and assisted living facilities. That means that despite all the amazingly hard work that those facilities have been doing to slow spread, just like the rest of the community, we're seeing cases in those settings as well. Our goal continues to slow that down. So whatever you can do individually to protect those vulnerable populations by wearing a mask and keeping 6 feet is really my strong advice to everybody. We also have a question that is, if the county continues at this pace of new cases, are we worried about local hospitals having overflow areas for crisis care soon? We're already concerned about hospital capacity, but we also know our hospitals have done an absolutely amazing job planning for increased cases and having implementable plans to deal with that. We are amazingly fortunate to have such strong healthcare systems in this area. We also are amazingly fortunate that we have healthcare partners that are talking with each other and working together to manage not only the COVID cases that are coming in, but all of the other usual hospitalizations that need to have immediate attention. Our hospital partners are expressing concern. They're expressing concern about disease spread and they're asking for help, and that's what we need to give them. As our hospitals are strained, we continue to meet. We're having a meeting tomorrow, and we continue to meet with healthcare leadership about what we need to plan for and what, if anything, needs to be operationalized as the volume increases. We're really counting on all of you to make sure that that doesn't happen. The alternative site that's available in Wisconsin and other alternative sites are also always an option. But right now we're managing this locally and we're counting on the community to make sure that we don't increase our level of concern about not having space for people for COVID-19. We also had a question about what's the most important thing for people to know about COVID-19 in our area right now. I guess my message to you is that this is serious. It's also something that we can do a whole lot about. We are not powerless. We can wear a mask. We can stay 6 feet apart. We can just be really clear that while it's hard, we can have different kinds of conversations with family and friends. We can find different fun things to do. We can show each other that while it's difficult, we can find a glass half full when we're talking to our children and when we're talking to our families. I have family members that also, like me, are struggling with not having the same connections. And part of it is our approach and seeing where we can find some opportunities for some fun new ways to connect. This is a community issue and we need a community solution. If we don't do that, we're going to see more deaths and we're going to see higher hospitalizations. And I don't think any of us want that in this community for our friends, neighbors, coworkers, and family members. So please take this seriously. Please do your part and do those simple things, even if they're hard, those simple things to make a difference. So I think that's all our questions that we got in advance. Audrey, did we get any questions via the chat box?
No, there aren't any questions in the chat box. So are any of our media partners who are on right now, would you like to unmute and ask a question?
Okay, thank you again, everybody, for joining us. We appreciate you being with us today and sharing information across the community about what's happening with COVID-19. We also appreciate all the hard work that people are putting into making a difference in this community, and I really thank everyone for that. We have across Eau Claire County people that are really working hard and taking it seriously, and my appreciation goes out to all of you. So thank you. We'll be back next Thursday with the same format and same update, and I look forward to talking to you then.